Up to 88% of Kenyans could test positive for the COVID-19 virus, by January 2021. And that is according to the KAVI Institute of Clinical Research. This was revealed when the Kenya Medical Association appeared before the Senate Ad Hoc Committee on COVID-19. During the meeting, the association cautioned against the easing of movement in the country or lifting any measures put in place to contain the spread of the disease. The doctors say that without sufficient data to support the easing of restrictions, the situation could easily take a turn for the worst. Anita Nkonge has more.
When the Kenya Medical Association appeared before the Ad Hoc Senate Committee on COVID-19, it did not mince its words.
We now recommend any decision on enhancing or easing movement restrictions must be based on evidence, which evidence entails doing sufficient testing in order to understand the spread of the disease in the country.
According to the association, Kenya must first ensure that the rate of infections declines for 2 weeks consecutively before considering easing of any restrictions.
A national network for contact tracing, quarantine, and isolation that is free of coercion and encourages people to cooperate should they meet the criteria for this. There should be adequate bed space for clinical management of cases in identified facilities covering the whole country. And as we indicated before, this can even be regional treatment facilities that cover several counties at a go.
In their submission, KAM also recommended that regulations be put in place to allow for home-based quarantine and isolation where possible. According to the director of KAVI Institute of Clinical Research, up to 88% of Kenya's population could test positive for COVID-19 by January 2021. This is following a study done by a team of researchers and modelers at the University of Nairobi.
Part of what we have actually been doing is to critically look at this outbreak. We managed to put together case management that was looking at how cases are going to be managed. We advised on isolation and quarantine actually done by the ministry. And then we also looked at various projections in the country and projections, which the peak will be 2021 around January. We might actually have 2 million people infected, will be mild to asymptomatic. Those infected and moderate average about 300,000. Those infected and severe will average about 100,000.
The country has been on a dusk to dawn curfew for the past 2 months. Anita Nkonge, NTV.